in a number of countries, including China, Italy, Spain, and here in the United States, where I am sitting, how the localized spread of COVID-19 in densely populated areas can easily overburden health systems. In many of the low and middle income countries where we provide support, the COVID-19 pandemic threatens to overwhelm an already strained health system, where the number of hospital beds per population is far less compared to Europe and North America. For example, in Nigeria, there's about half of a hospital bed per 1,000 people. Furthermore, there are discrete populations within these countries that are at increased risk of experiencing COVID-19 complications due to high prevalence of chronic conditions such as HIV/AIDS, tuberculosis, malaria, and a growing population with non-communicable diseases such as hypertension, obesity, and chronic lung disease. In addition to this, there's widespread poverty and malnutrition that places people at even higher risk for complications due to infections. So for a number of these reasons, we feel that it's critical to mount an effective preparedness and response strategy to protect our most vulnerable populations and minimize COVID-19 morbidity and mortality globally. So I'm going to talk a little bit more about how we see ourselves playing a part in the COVID-19 preparedness and response. In this rapidly changing environment, BAO Systems is offering to support to improve the availability, accessibility, and transparency to inform COVID-19 preparedness and response actions. Our approach relies on using existing data to identify communities and populations that are at high risk for accelerated spread of COVID-19 and complications from COVID-19 infections. By using this information, we can better prepare local health systems for surges or anticipated surges in hospitalizations, as well as disruptions in normal healthcare delivery. As COVID-19 surveillance data are collected, these data models can be updated to respond to how the local transmission is actually spreading from community to community or population to population, and used continually to inform decision-making across all levels of the health system. So we envision a scenario where governments can better target communities with IPC campaigns about physical isolation to flatten the curve, as we've seen here in our press a lot lately in the United States, where governments can better prepare their health system for surges in COVID-19 cases and ensure that their health facilities have the adequate supplies, human resources, and other commodities that they need to handle the uptake in patients, and then to ensure continuation of essential services or emergency services, as well as distribution of essential medicines to those who need it. So taking a look at the types of data that can actually help a better preparedness plan. These next few slides are going to focus on example data sources, and we're going to use Nigeria as just an example. So shown here on the left is a map of population density, and as you can see, Lagos is a very dense city or area, state that is, and that makes, similar to what we've seen in Italy, Spain, and China, that these really dense areas of living are at increased risk for accelerated spread for COVID transmission. On the right, we're seeing a map of people currently receiving ART. These data, the HIV data is provided by PEPFAR, their Spotlight. And what we're showing here is we know for a fact that immunocompromised patients, such as those infected with HIV, particularly those that are not yet on treatment, are at higher risk for experiencing COVID-19 complications. And so as a result of HIV, as well as co-infection with tuberculosis, we know that these communities and these populations are extremely high risk for developing increased symptoms, developing more pneumonia, and requiring hospitalization. Mapping these data points together enables us to draw better conclusions of where we might expect to see COVID having a larger impact on the health system and communities. On this slide, I'm showing data presented by Frame. Frame delivers precise information about people down to the 1 square kilometer level in Africa, Asia, and Latin America. They've made publicly available data spanning 70 plus developing countries, specifically for the COVID-19 response. In these map layers that they've provided, they reference demographic, lifestyle, and health factors to develop a COVID-19 risk profile. So what you see here is a combination of information from where there are higher concentrations of elderly population, households that use dirty cooking fuels, which is a proxy indicator for lung disease, and at least one smoker in the household, which also contributes to lung disease and cardiovascular diseases in general. And through their modeling, they're able to identify the areas that are at risk. And so just to point out that this risk profile seen here on the right is not a compilation of just these 3 indicators, but I believe that there are a number of indicators that are contributing to this. So publicly available data sources such as this provided by Frame can also help strengthen identification of high-risk communities. Showing here are data taken from Johns Hopkins. They have a publicly available web portal that tracks surveillance of COVID-19. And what I have shown here are just cases in Nigeria over the past 7 days, as well as today. And so again, as more surveillance data about expected cases, confirmed cases, recovered cases, and/or deaths, this information can be combined with the other population data that are available to really track and identify the next at risk community down to a very local site. And so if you see outbreak of COVID-19 surging in one LGA in Nigeria, for example, then you might be able to expect that the surrounding LGAs or districts, their equivalent of a district, are at higher risk for accelerated spread. So just showing this slide again to show and to reiterate how these data can really be used to inform preparedness and response actions, particularly for COVID-19. So during the remainder of this presentation, we're going to discuss how BAO Systems can support governments and organizations to achieve our vision for a more informed COVID-19 preparedness and response. So we'll start off by looking at some options for collecting COVID-19 data on the ground where no tool currently exists, or where the tools that are currently in place are not effectively meeting the needs for the COVID-19 surveillance. We'll look at approaches to facilitate system interoperability and crosstalk between COVID-19 surveillance systems and HMIS or supply chain systems if they're not already integrated. We'll look at how our analytics platform can help advance and expand these integrated analytics by combining external data sets as well. And then lastly, we'll finish by touching upon how data can be made available to any number of business intelligence or advanced analytic tools if that is what is needed or desired. So the first tool I'm going to talk about is our DHARMA platform. DHARMA platform was recently acquired by BAO Systems. It is a very easy to use mobile data collection tool that takes no prior experience to develop forms. Instead of taking weeks or months to build a form, it takes a few hours or days. DHARMA users require no formal training in order to use the tool, and it's also available on both Android and iOS devices. In areas lacking an existing data collection tool, DHARMA can be quickly deployed and or updated with little training. And so we're offering DHARMA platform as an easy, scalable system to collect COVID-19 data on the ground. So our DHARMA platform offers multiple modules, which I am going to, show right now. So we've already developed a COVID-19 self-assessment tool. This self-assessment tool complies with CDC recommendations and was initially developed to help healthcare workers assess their own risk for COVID-19, but can also be used for providers to assess the risk of their patients. So what I'm going to show here now is just the COVID form. Basically, this particular self-assessment has a number of sections that are broken out by demographic information, address information, contact information. If they're arriving from a port information, hopefully you guys can see that's a little bit better now. Whether or not the provider or person has planned to travel, and lastly, COVID exposure information. So skipping ahead just to the exposure information, again, this form looks at whether or not there's been a known exposure and can track the date of the last exposure. So you can enter in a date here. You can enter the first date. It's pretty easy. We can enter today. Actually, today's the 1st, so I guess I won't enter it as tomorrow. And then you can go down to potential exposure locations and fill in information as required. So here we see potential exposure country, contact of known case, whether or not if they were exposed to somebody who had COVID-19, they can identify who that individual is. And the DHARMA platform will be able to link the identified case or patient 0 with this particular exposed client, whether or not the individual or healthcare worker traveled to an affected area. And so as you can see, this is a fairly simple form. It takes very little time to deploy it. And what I'm not showing you right now is the mobile interface, but you can enter data both online or through a phone. And so it is appropriately adjusted for the context that it's needed. And so just showing a remainder of the form. There are results. Right now, there aren't really any data that we've entered into here, but you would be able to look at respondents. And so if you were a healthcare provider that was tracking your own exposure, you wouldn't have to fill out the demographic information, for example. You would just continue to fill out the exposure form over time. Now, looking
there, Catherine, just that the view that you were seeing there was the project administrator view. So you were building the form. This isn't what the end user sees. We're just showing the ease at which someone can put together a form to collect data within DHARMA.
Correct. And so if I wanted to add a new form, for example, this is what the end user would see. Again, this is the online interface, and there is a mobile interface to this as well. And so as a user, this is what they would see. And so you could check in. It lets you know which fields are required and which fields are optional, because there is no alert on that. So that is the DHARMA platform. Again, this can be used both as an exposure assessment as well as a surveillance tool to be able to track individual cases, confirmed cases, laboratory results, and contact history. So what are the advantages to the DHARMA platform? I've mentioned before that configuring or customizing a new form or a new project is relatively easy and takes hours to days. The user interface on the mobile is really easy to use and Oftentimes users require zero to very little training. It can be implemented at scale really quickly and aligns with CDC and WHO recommendations in terms of provider self-assessment as well as surveillance. In terms of how BAO can help, if this tool is of interest, we can help you to deploy this our DHARMA tool immediately, customize it with any additional customizations that you guys may need to fit your particular government or program context, as well as make these data available and integrated into DHIS2, which I will touch upon a little bit later in the presentation. The second tool that or platform that BAO supports is DHIS2. As many of you may know, DHIS2 has recently released their COVID-19 surveillance package, which enables for case-based surveillance, contact tracing, port of entry tracker, and they also have a higher level surveillance systems in both the event and aggregate data models for those countries or contexts where case-based data collection is proving challenging. So again, I don't want to go into too much detail on the DHIS2 form, but I can show it really quickly. So right here, if you guys are not familiar with DHIS2, when you first log into your DHIS2 instance, you'll see a dashboard. These dashboards are customizable in that you can arrange any of the visuals how you want them, and you can tailor them to different audiences. If you want to look at data, the case-based surveillance tracker for WHO, you would go to the tracker, and if you wanted to register a new client, you can see the form here. Let me make this a little bit bigger for you guys. So here you'll see that these data entry fields are in compliance with WHO recommendations on COVID-19 surveillance. So you can enter the date of birth, select that, it'll pre-calculate the age, you can enter a name. For some reason I've liked picking Mickey Mouse, who is a male. Again, and you can continue through this form and this will take you through a series of forms to enter additional data. And so once you've enrolled, then you would come down here and be able to look at additional stages, which include clinical examination and diagnosis, lab request, lab results, and health outcomes. So again, you're looking at different types of exposure, travel history, onset of symptoms. There's also the ability to look at the high level surveillance, looking at aggregate data. So if you wanted to enter data at a facility at the end of the day, instead of using it patient by patient, but to aggregate at the end of the day the number of clients that were suspected, confirmed, recovered, and does, these forms can be filled out daily or weekly depending on what is feasible within that context. Sorry, this is just, oops. What I wanted to show here at this point was taking data from Johns Hopkins. We were actually able to take their surveillance data, and I think that this is generally also a good resource for people that are developing programs around the COVID response. The tracker, the Johns Hopkins database collects information on cases worldwide, and you can see here that we've compiled a quick dashboard to enable ourselves to track cases of COVID-19. And so if we wanted to look at data, I showed you these data earlier. Sorry, this is taking a little while to update, but this is just being able to show that you can take selected cases and filter the data by a given country. So if we want to look at Armenia, for example, I'm not sure what it looks like in Armenia, but earlier in the presentation, I showed you what it looked like in Nigeria as of yesterday. So I'm not going to wait for all of this to load. So regarding DHIS2, the advantages to using the DHIS2 surveillance package, number one is that DHIS2 is globally adopted. It's used in almost 70 countries as our national HMIS. It is an open source tool with a core team of dedicated developers that are continually working on improving and adding new features to DHIS2 core. There's existing capacity at the country level and with many programs in order to support DHIS2, and the tools currently align with WHO recommendations. In terms of how BAO Systems can help, we can provide support around installing the configuration package either in a new DHIS2 instance or in a pre-existing DHIS2 instance, for example, a country's health management information system. We can help extend monitoring capabilities by additionally building out and adding to the modules that DHIS2 already provides. We can help around data analysis and with hosting as well of DHIS2. So now I want to turn a little bit. Those were our solutions for collecting on-the-ground surveillance data. But once you have those data, and again, we're not necessarily saying that our solutions are better than others. These are just the ones that we currently support. And so this next section of areas where we can provide support broadly applies to any data collection system or several data collection systems that are currently being implemented on the ground, such as ComCare, COBO/ODK, OpenSRP, and then again, DHARMA and DHIS2. But looking at how we can facilitate system interoperability between these on-the-ground data collection tools with HMIS or other surveillance systems at a larger scale to improve the types of analytics that can be done and enable responders to better make decisions about where they can allocate resources. So let's, as an example, we want to look at one of the pieces of information that I mentioned before was being able to look at HIV/AIDS data, because it will help us identify populations or areas at high risk for COVID complications, resulting in increased hospitalizations and added burden on the local health systems. And so by looking at HIV/AIDS data, we can help inform where resources need to be directed or redirected, and also look at the long-term outcomes as to what impact COVID-19 has actually had on the HIV/AIDS infected populations and whether or not those individuals have been able to continue on their ART treatment, or whether the disruptions in the healthcare system have resulted in a lot of patient dropouts or treatment dropouts. Again, this is just looking at the data from Nigeria and showing sort of increased spread, and the ability to be able to map COVID-19 as it spreads throughout a country will help us to be able to do micro-level planning. In terms of integration, BAO Systems has an integration driver which facilitates data flow from one DHIS2 instance to another. And so in a country, if they or a project, if the decision is to use DHIS2 for COVID-19 surveillance tracking, we can take those data and integrate it into HMIS to enable some of these integrated data analysis, such as that between COVID-19 and HIV/AIDS. Their integration driver allows scheduled and automated data flow from one direction to another through the backend, and requires support around mapping between indicators if there is no existing commonality between data units, and so things like organizational units and data elements and category combos. If you're familiar with DHIS2, these will all sound like familiar terms to you. But basically, after a manual mapping process, the integration driver can facilitate that data flow in a scheduled fashion. This is of particular use in a number of low and middle income countries, because they do use DHIS2 as their HMIS. Another way that we can use our integration driver, or their integration suite of tools, I should say, is to look at case-based data collection tools such as DHARMA or DHIS2 or ComCare, and to be able to aggregate those data and then feed that into HMIS or another DHIS2 instance, from which those data can be visualized in decision and support, and feedback can be provided back to the users on the ground, such as healthcare providers. Again, this, usually these kinds of processes takes days and weeks to do manually, and does not enable real-time data analytics because of the lag. And so oftentimes when these processes are done manually, by the time the data are aggregated into HMIS, the data are then outdated and not very useful for providers on the ground for making those decisions that they really need to enhance client case management. The next few slides and demonstration are going to talk about our analytics platform. So I'm going to hand it over to Lars to talk a little bit about our analytics platform. Lars, I can advance the slides if you're
Great. Yeah, excellent. Yeah, let me see if I can share my screen. Yeah. All right. So can you see my screen now?
I cannot.
All right, one sec. Can you see my screen now? Or?
Yeah.
Yep. All right, great. Yep. So so Catherine gave a good introduction to this. So BAO also now features a analytics platform that essentially allows you to integrate data from different sources. And this can, of course, include data coming from DHIS2, but you can also ingest data from all types of other sources. So we're able to pull in data from different types of databases, existing systems. We're able to build custom connectors to pull in data from bespoke systems. And these data sources can then be integrated into a platform where the data can be overlaid, integrated, joined, and so forth, and presented in an integrated way. The platform also allows for connecting with most BI tools on the market. So if you have your favorite tools such as Tableau or Power BI or SPSS or Stata, it's easy to connect those data sources as well. We also allow for what we call one-click ingestion of public data sets. So we do have built up a catalog of public data sources from which you can pick and ingest into your platform, essentially. The platform is scalable. It's built on the AWS infrastructure, meaning it's very scalable. You can have a lot of data in there, almost unlimited in the sense of size and volume. We do feature things like security models. You can provide granular access to people in terms of data sets, which users should be able to see what. And we do provide basic features such as logging and alerts and so forth in regard to the connections to different systems. Excuse me. So just to give you a little bit of a quick look at this. So this is the current UI for the analytics platform, we're working on a new version. So this is the basic version of the UI. So this is essentially what we call the data catalog, from which you can set up connectors to different types of systems. So as you can see in this screen, we have a range of systems here. We have, for instance, the DHARMA instance that Catherine just showed you, the data.baosystems.com, where we have ingested data that we have scraped from Johns Hopkins APIs and ingested into DHARMA2. But here we can also envision integrating with the DHARMA2 installations, running the University of Oslo metadata package for COVID and other sort of DHARMA2 configurations. We can also, of course, ingest data coming from different types of mobile systems like DHARMA, as Catherine just mentioned. We also have the ability to upload your own data sets. It's easy to just take a CSV file. You can say, I want to connect a data source. I can say, I want to connect to a CSV file upload. I can give it a name. I can select a CSV file, and it's easy to ingest data just from arbitrary C files. So if you have sort of ad hoc data sets that you would like to integrate, that's easy to do. Setting up a connection to DHARMA2 is easy. You say connect data. You click on DHARMA2. And then you have to provide some basic information like the name, description. You can say the owner. Here you can build up different types of metadata around your data catalog. We can schedule this to run at different points during the day, like every 15 minutes, every hour, every day at midnight, and so forth. You need to provide some basic information for your database, for your web API, essentially like where does this instance live. A prefix for the platform, and that's it. So when this is created now, this is going to be run automatically at the given frequency, and then be populated into the platform automatically. So, so this is where you have to also connect with data sources like Postgres and MySQL, MS SQL, Oracle, and so forth. So having a quick look, so this was the site that Catherine showed you. So here, this is the DHARMA2 installation where we have pulled in data from Johns Hopkins through an API called Worldometer. So here we can see we have lots of different types of analysis. We can look at, the fatality rate by country. We can look at maps. We have this nice little feature now in DHARMA2 where you can look at kind of a time series of the map of confirmed cases worldwide, like this. You can see the map evolves like that. We have overview by country. We have confirmed cases by US states, confirmed cases in Europe, and so forth and so forth. We also built up analysis by country. So here's a simple dashboard by country. Confirmed cases, deaths and recovered, new cases and new deaths, newly infected versus newly recovered, different types of analysis around the latest COVID data. We also have the PEPFAR data. So we have ingested the PEPFAR data, this case for Nigeria, which allows us to sort of overlay and look at in HIV data in relation to this. So now that we have set up the connector between this installation of DHARMA2 and the platform, the data automatically goes into the platform, and we can start to look at it from the BI tool of choice. So we can say connect, which is going to give us the connection information that we need to connect from a BI tool. What I'm going to show you now is essentially Tableau. So Tableau is a popular BI tool. Most of you have probably used that and familiar with it. It's now really easy to connect Tableau to this platform. We can go to data. We can say new data source. We say Redshift, which is the underlying database that we use. We enter the information that you just saw on the screen, like the database name, the server, meaning the host name, username, password. And that will give us access to DHARMA2 data like this. So now on the left side here, we can see all the dimensions that we have set up in DHARMA2 automatically becomes available in Tableau like this. So with this, we can start to play around in Tableau, everyone's favorite tool, and create all the beautiful visualizations that Tableau allows. So here we have a very basic analysis where we look at cases by some selected countries. So we have confirmed cases, deaths, new cases, and so forth. We can also do, of course, things like line charts and look at confirmed cases, blah, blah, for the last days up to the current date. We can do the same for the entire world if you want to do that. We can look at specific countries, in this case, France and Spain, and we can see deaths and new cases like this and compare and see how they compare. And again, we can look at also other different types of data sources. Here's PEPFAR data, HIV cases. In a pivot table, we can do specific analysis for Nigeria, where we look at quarterly data, where we have HSC tests, meaning testing data, positive tests. We have TX curve, which is people on treatment currently. TX new, meaning new people on treatment, and so forth. So we can compare all these different indicators across the last time periods. So this, I'm just showing you a few examples here. I think it's just your imagination that sort of prevents this, that stops you here. You have full access to the data in Tableau, and you can use your skills there. It also connects to other tools like Power BI. You can also connect to web-based tools like Redash, Superset, and so forth, Metabase, these kind of different types of tools. Yeah, so I think that concludes the quick demo.
Thanks, Lars. Okay, can you guys see my screen?
Yep.
Okay, thanks, Lars. I can't see the chat window right now. So what Lars showed you is the current UI that's in place. In the next week or two, our new UI should be ready. We're currently expediting this right now. So what I'm going to show you right now is a preview of the new UI. And so basically you would come here, there would be a welcome page. You can immediately connect a data source. Like Lars mentioned, DHIS2 is just an easy one to show where you can set up the run frequency, put in your host name, your database name, and your credentials, and continue to fill out the form. And so with required information, you can select what type of data you're going to import and make sure that you are targeting it to the right data warehouse. And so once you hit connect, that you'll be able to see an overview of the information that you just did. There's a change log that will notify you on any changes or updates that have been made to this connection. You can refresh the data source, you can remove the data set, or you can, again, edit some of these settings. I'm going to discard the changes, going back to the data catalog. Again, in the data catalog, you will see a list of all of the different data sources that are available. We will enable a search by name or type of source and look at, from this view, you'll be able to select a specific type of data. So here's OECD data. And you can see sort of the connection information as to what was pulled, where it's coming from. This one's coming from an API, and where the target is, again, where the data is being entered. So this basically allows you to just get a preview, again, of what the new UI is and what that might look like. One of the value adds of the analytics platform, so kind of talking about the difference between some of our integration suite of tools and the analytics platform. The integration suite of tools that we have are for specific system-to-system integration and interoperability. So ComCare to DHIS2, COBO to DHIS2, DHIS2 to an EMR system, for example. And so those connectors are very specifically built for the input in the sort of upstream and downstream data sources where the data is flowing. Our analytics platform brings all of these different connectors together, essentially, and stores the data in a central data warehouse. In addition to having any number of connectors to enable all of these data to sort of speak to one another in the data warehouse, we also have a BAO curated set of publicly available data. And so we're currently building them out right now. Right now we have DHS data, we have PEPFAR, publicly available PEPFAR data in the data warehouse as well as this COVID-19 data from Johns Hopkins. But our goal is to continue to build out the data catalog with freely available data sources so that you guys can use them in your analyses. And so if you want to look at data from the latest DHS program, certainly for COVID-19, I think that there are a number of overlaps between health behaviors and health risks that will help with COVID-19 targeting and preparedness. Again, going back to the slide that I showed you previously with FRAME, looking at the cooking fuel source, looking at HIV/AIDS prevalence, malaria seasonality, tuberculosis prevalence, smoking, cardiovascular disease. A lot of that information is also available in DHS program surveys, and so that can help provide sort of that baseline understanding and baseline targeting and preparedness for a program that is looking to prepare for COVID-19 infections. So going back to our slide, I think looking at the goal of an integrated solution and why we might want to use an integrated solution, it's really looking at the ability to improve insights and decision making across all levels of the health system. Using data captured, this allows you to look at case level data or individual level data captured by a tool such as DHARMA or DHIS2 or ComCare, and being able to analyze that together with either HMIS or HMIS and supply chain information system data. And this will help you gain a holistic view of an entire health system to understand which communities are at highest risk for viral transmission, what resources such as commodities, supplies, equipment, and human resources are available, and how those might need to change based on COVID infection patterns. It allows you to conduct analysis of comorbidities to understand a deeper understanding of cause and effect. So for example, in Nigeria, there's currently over 800,000 individuals receiving ART, and a proportion of individuals that are HIV positive that may not know about their positive status or have not yet started ART that can then suffer downstream effects of COVID-19. So again, this could be things like not being able to access routine health services and ART refills. I think as we continue sort of the aftermath effects of COVID-19, looking at what those, how the pandemic may have disrupted supply chain information systems and healthcare access, what that has done to ART retention rates, and whether or not we're witnessing increases in drug-resistant HIV strains. So that's just one example of how these integrated data can be used. So in terms of ways that BAO Systems can help, we can deploy any one of our integration suite of tools or our analytics platform, which has more sort of integration and interoperability and analytics power. We can customize our solutions to fit your specific needs. We can provide support around analytics and visualization, including machine learning and predictive analytics, and leveraging these rather complex data sets to get the information that you actually need to make decisions to better inform the COVID response. With that, that is the end of our presentations.